Atropine is a medication commonly used by paramedics in emergency situations, primarily to treat bradycardia, which is a slow heart rate, and certain types of organophosphate poisoning. When administering atropine, it's essential to follow established protocols and guidelines. Administration guidelines for atropine 1. Indications: symptomatic bradycardia, organophosphate poisoning. For bradycardia, adult doses typically start at 0.5 milligrams intravenously repeated every 3 to 5 minutes as needed up to a total of 3 milligrams. For organophosphate poisoning, initial doses may be higher, often starting at 2 to 6 milligrams intravenously repeated every 5 to 15 minutes until symptoms improve. Atropine is usually administered intravenously. In certain situations, intramuscular administration may be appropriate, particularly if intravenous access is not readily available. Continuously monitor the patient's heart rate, blood pressure, and overall response to the medication. Be alert for potential side effects such as dryness of mouth, blurred vision, and increased heart rate. Use with caution in patients with certain conditions, including glaucoma, urinary retention, and myasthenia gravis. Record the administration details, including dosage, time, route, and patient response. Always consult local protocols and medical control for any updates or specific instructions regarding the use of atropine in advanced life support situations.